In 2010, there was a great big movement by the Center of Disease Control and the federal government. Matter of fact, in 2011, they had a presidential national conference where they called in the biggest and the best, all the people, and said, we've got to solve this problem. So we're going to change, we're going to get physician education, public education, policy changes, we're going to increase drug enforcement, we're going to change the way we handle pain. How successful was it? By the time we get to 2014, there's a 14% per year increase in the deaths related to opiates. We have during that time, because if people can't get the pharmaceutical opiates, they switch to heroin. It's fueled the whole heroin epidemic, which is devastating. And there was an increase in 26% to heroin overdoses. So this is a problem. And what has been proposed on their alternatives to actually try to get this fixed has been a complete disaster. And it's getting even worse. So we have an answer. Evidence-based practice. Evidence-based has shown that the pharmaceutical route doesn't work. Okay, for chronic pain, it doesn't work. Nobody is in disagreement, even the pharmaceutical companies. What does work? What does work is chiropractic care, rehab, auricular therapy. There's many different ways of doing that. Acupuncture, manual therapy, nutritional, homeopathics, and another type of auricular therapy called P-stim. That should be 80% of all pain relief should be covered in that. That's what the evidence actually has shown. And the standards for pain relief, they put out what is the best treatments. This is what is said should be done for 3 months before anything else is tried. This is the answer. What we provide in here for pain is the evidence that has been proven to be effective. And we've shown that in our office. We just basically clear people out of pain. Go ahead and change. Seek structure function care. We also, one of the things that we have done is we have gotten an integrated type of approach. So we do have a medical doctor on staff who is our director of our practice. We also have a nurse practitioner. So we do provide all the combination of both the structure function care and the disease care. As you go into healthcare, there are 2 different tracks that the FDA approves things. There is something called structure function and disease care. Structure function, most people aren't aware of really what that is. And that is a means of taking things and bringing it back to normal. And you can do that structurally through chiropractic massage. And there is a normal position that everybody should be at. And that's basically what we're doing on that, is bringing things back into normal. And then also functionally, bring the body back into normal. Normal balance, the word on that is homeostasis. Homeostasis is the definition of health. And homeostasis is the balance of the body. And when you are in balance, you don't have pain. The other type of care is disease care. Disease care is where you are taking care of the symptomatology of the body. Symptomatology, those types of things are very good for getting that under control, but it doesn't ever bring health. When you take a pharmaceutical, it does not make you healthier. Okay? It's not designed to do that. It's designed to help with the symptomatology, which is very important. And we believe in that balance, and that balance is 80% of all care should be structure function. 20% of all care should be disease care. That is the accepted type of a balance that has been proven through evidence-based care as very effective. We had a study up in Chicago where they took 65,000 people. That's a pretty good study. They did the study for 10 years to see what type of effect, comparing the two, and it was a very scientific on how they balanced them out. So that it wasn't the people's choice, they were assigned to one of these two categories. Over the 10 years, there was a 60% savings with structure function care over the disease model. There were 85% less adverse reactions where you had to go to the hospital, you had different types of things that were off. In other words, you didn't have iatrogenic, which is doctor-caused problems that occurred. 85% reduction. The patients, as they were looking at the healthcare system, and they rated the two, they rated the structure function care as 90% approval rating. For the disease care, it was a 60% rating. The most interesting thing is because the specialists were the disease care factors, because they both use the same specialists, oncologists, gastroenterologists, cardiologists, all those types of things. The MDs, specialists, rated the structure function care 98% approval rating, the disease care 40%. And they said, why? They said, well, we had to spend 85% of our time on the disease care model, because that's where all the problems were coming from. Only 15% of our time on the structure function. So this is a system that would solve our healthcare crisis. It would improve the health of the people by 85%. And even the medical profession said, this is the best way to go. So that's what we're providing. We realize when disease care is necessary, when pharmaceuticals are necessary. But what we want to do is start to change the healthcare of America, and this is the way to do it. What I want to do is just open it up now to any questions. Anybody have anything in particular?